Welcome to Little Luxuries. I'm Michelle Martin. Now, we know that age shows on the skin, on the back of your hands, or on your neck, but can a popular injectable lift, tighten, and rejuvenate beyond the skin of your face? You've heard of Profhilo, I'm sure. It's known to have anti-aging effects on the face, but can it rejuvenate your skin elsewhere? And is it worth it? Ageless Medical's Dr. Lam Bee Lan joins me live today to help me figure all that out. Good morning, Dr. Lam.
Hi, Michelle, and a big hello to all the listeners of Little Luxuries.
Oh, we're so excited to hear that there could be something for all those lines on the neck that
Absolutely.
is not surgical.
Yes. Now, we've all known, Michelle, as you mentioned, we always take care of the skin on our face, but we often neglect the skin on our neck, and this is like our second phase, the skin on the back of our hands, the skin on our knees and elbows, the inner arms. But these are exactly the same areas that actually reveal our age, don't they? So
Absolutely
yeah,
spot on.
exactly. Yeah,
So let's
yeah.
talk about, there may be some of us who are new to this whole idea of this very unique form of hyaluronic acid, Profhilo. So maybe you could backtrack a little and tell us how Profhilo works, what it's used for. And we're talking today about Profhilo Body. Is there any difference between Profhilo Body and Profhilo for the face?
Now, Profhilo is an innovative hyaluronic acid injectable skincare. Now, it is also known as bioremodeling agent. Why? Because it is able to stimulate the growth of collagen and elastin and fat cells in different layers of the skin. We can see this is the superficial layer, the epidermis, the deep layer, the dermis, and the fats. And Profhilo is injected at this layer, which is at the deep dermis. It is able to stimulate the growth of collagen, elastin, and the fat cells in the fat layers. Therefore, it results in multi-level remodeling of the tissues to improve skin laxity, skin hydration, and skin elasticity. And the safety and effectiveness of Profhilo is proven through many clinical studies. You know, Profhilo is very unique. The unique characteristics of Profhilo makes it, I feel, a game changer in skin improvement and skin quality treatments. And as I mentioned, all these are backed by solid science. Now,
Mm.
firstly, Profhilo targets, as I mentioned, 3 different layers of the skin. The results in remodeling of the skin to improve skin laxity, skin hydration, and skin elasticity. It is therefore excellent if you've got dull, tired looking, and very aged looking skin. Now, secondly, Profhilo contains 64 milligram per 2 ml of the product in a 2 ml syringe, and this makes it the highest concentration of HA in the market. We know that the function of hyaluronic acid is to absorb water into the skin. It is found here, and it
Mm.
is therefore able to cause the skin to plump up, okay, to swell up. It therefore increases skin turgor and hydration. And Profhilo has 64 milligram per 2 ml of the product. It is therefore able to do this very, very well.
And
Now,
does it do this
thirdly,
without adding? I'm sorry, go ahead with your third
yeah,
point.
you're right, Michelle. You're absolutely right. It does it without adding any volume. So Profhilo is not a filler. Okay, although it is a higher hyaluronic acid, Profhilo is not a filler. It doesn't make your nose sharper, your chin pointier, or your lips fuller. It doesn't. So
It
it's
won't
just
do all
basic.
that.
It won't do all that. It's just basically injected 5 points on each side of the face, and it acts to improve skin laxity, skin hydration, and also skin elasticity. The
Which
fourth
is also
most
gonna help the lines on the
absolutely,
neck. And
yeah,
and it will help the skin that's lax if
on
you
the
have turkey
elbow.
arm and
Correct, correct.
various knees, baggy knees and all that. Now, Dr. Lam, we are so accustomed to Profhilo for the face. You know, some people think of it as an injectable moisturizer in the hands of a doctor, of course, to bring a glow to the face. So, now we're talking about its use on the body. Has it always been able to be used on the body, or is this a different formulation?
Now, very, very good question, Michelle. Now, this is Profhilo for the face. It is a 2 ml product containing 64 milligram per 2 ml of the product in one syringe. And this is Profhilo Body. Basically, it has 3 ml of the product in 96 milligram of the product in 3 ml of the syringe. They're basically same. So you ask why the body? Okay, why the body? As I mentioned earlier, Profhilo is proven through many clinical studies. IPSA, the company that manufactures Profhilo, okay, first came out with Profhilo, an injectable skincare to improve the skin laxity, hydration, and elasticity on the face and the neck in 2015. As I've mentioned in many clinical studies to show its safety and efficacy. Now, the company has gone one step further to let Profhilo become the reference point in aesthetic medicine for skin quality improvement, not only on the face and the neck, but on other parts of the body. For example, the skin on the back of the hands, the inner arm laxity, as you've mentioned, stretch marks on the abdomen, and also the décolletage. So they've also, after the face, conduct studies to show its safety and efficacy on the inner arm laxity and on the abdomen. So IPSA is a company that is really into R&D to show that the product is safe. You know, there are many.
So they've done studies. They've done studies that now show
studies.
It works on different parts of your body.
So
that's
you know,
what's new.
Yeah, that's what makes it different. I feel. And why the body? You ask why the body, right? Face, but why you want to do the body?
No, I know why you want to do the body. I mean, there are times I've been thinking, I wish I could just pull up my neck like a baggy sock. Can I just pull it up?
You wish you could inject Profhilo from the neck to the rest of your body, right, Michelle?
Dr. Lam, I have to ask a question that listeners are thinking. How quickly can we see results if we do want to use Profhilo on a saggy neck?
Now, the neck, as we mentioned, is the second phase, and it is a place that shows our age. And the many factors that affect neck aging. It includes the presence of horizontal necklaces, which I have. Today I'm wearing a turkey neck. Okay. It also includes the loss of skin elasticity and skin hydration. Also, the presence of the turkey neck, the vertical platysmal neck bands, which is due to your muscles becoming hyperactive as you age. And Profhilo for the neck works very well to improve neck skin laxity, to improve skin hydration and elasticity. So
for
when
both
you see
necklaces and the horizontal ones.
No. Yeah, very intelligent question, Michelle. No, it doesn't. So for the vertical platysmal neck bands, we actually need to relax with botulinum toxin injections.
Okay.
So
there's a cocktail.
Yes, it's a cocktail. It's a combination treatment.
Profhilo
Profhilo only improve neck laxity. It only improve hydration and elasticity. So for the vertical neck bands, we need to inject botulinum toxin to give you a Queen Nefertiti neck lift.
Queen Nefertiti
neck lift.
I love that.
So
See,
normally,
I always say if you go to Dr. Lam's office, that's when you learn that being aging is not inevitable, because she has a whole arsenal that she can work with you on.
Absolutely.
In your opinion, Dr. Lam, what is most exciting about where Profhilo can be used, given the studies that we know now? What is most exciting about where it can be used for its anti-aging effects?
Now, firstly, we have mentioned Profhilo proven through many clinical studies to be used on the face and the neck with excellent results. I think for the Profhilo body, the Profhilo body that we can see in this box, it can be used on décolletage, the inner arm laxity, stretch marks on the abdomen, even the crepey skin on the knees and the elbows with excellent results. But of course, for inner arm laxities and the abdomen, we actually have to consult the doctor and we have to discuss as to whether we need combination treatments and how many sessions are being required. But they all produce excellent results, and these results are all backed by science.
Okay. And you need a series of treatments the same way you need a series for the face to see improvement on crepey skin elsewhere, elbows, knees, and things like that?
Yes, correct. So, Michelle, this is the Profhilo body kit. Okay, yeah, you can see this. So inside this kit, actually, there are 2 boxes of Profhilo Body, the injectable skincare that we inject in the clinic, after which the patient will use this body patch, which we apply on the injection site to soothe and to moisturize the injection site. And then the patient will bring back with this Profhilo body cream to apply on the injected sites and the body to continue to tone the skin and to hydrate the skin. So this Profhilo body is performed same as the face and the neck. Okay, three sessions, 2 to 3 sessions, 4 weeks interval. And thereafter, the patient can repeat the treatment once every 3 to 6 months, depending on the skin laxity and the needs and concern of the patient.
All right. So Profhilo is synonymous with a couple of injection points. I think it's five on either side of the face. Do you have to vary the number of entry points you're going to be using depending on the area? Because neck is so much more canvas than décolletage or knees, for example.
Yeah, very, very good question. So people always ask me, why 10 points? Why not 20 points? Why not 5 points on the full face? So again, as I've mentioned, IPSA is a company that does everything through science. So they've done clinical studies to show the 10 BEP or bioaesthetic injection points of Profhilo on the face, on the neck, on the decolletage, the inner arm, and the abdomen to show the safety and efficacy. And they find that there's no difference between using 10 points or 15 points or 20 points. If you use 20 points, the patient will suffer 20 injection sites, right? So if you use 10 points, you actually lessen the injection points, lessen the side effects of bruising and pain for the patients. The patients are
Ah.
happier, and of course, the doctors are happier. Now, one very unique characteristic of Profhilo is this: Profhilo behaves and flows like a liquid.
Oh.
Yes, that is very unique. And this unique characteristic allows